So, welcome to the Cosmic Powerhouse and another episode of Let's Create a Healing Temple Together. Today we have John Yu as also our guest. He's from California, from the United States, and he's an anesthesiologist and the co-founder and CEO of iPill Dispenser and the CEO of Quivive. John, let me ask you if that is a
Sure.
Quivive. And yeah, he will talk today with us about the safer handling of opioids, a safer medication management, and actually also how we can better the situation with pain treatment, which is actually a cause of all of this. And he will give us data and overview what is actually available to create this healing temple in that aspect and where we should be aware of. But before we start with a conversation, I would like to open a sacred space for all of us. Also, here is about safety. In this term, it's about energy. So let me open the Cosmic Powerhouse safe space, please. So let's fold our hands and bring the bubble up. That is our soul bubble, our absolute individual energy bubble. And I take it over the virtual room to include you all. And let's have 3 deep breaths so we are all grounded and open and have full attention for John and his message today. So breathe in and out and in and out. And the third time. And ground. Okay, John. So let us hear what actually brought you to this topic. I mean, you are an anesthesiologist. You have to deal with opioids, of course. But why do you have that passion to have safer handling of opioids, of medicals, and of pain treatment? So what is the cause of this passion?
It's been a journey. I'm an anesthesiologist, chronic pain management, addiction medicine physician. Actually, it's a religious pursuit. My wife has been trying to get me to be a Christian for the better part of our marriage. In 2018, I decided to get baptized in the River Jordan in Israel as a way to accept God into my life. When I came back, someone said that when you get baptized, it's supposed to change your life. So I was in church one day, and the pastor said, "What are you doing to evangelize?" I had nothing. And then I started to think about things, and I thought about my skills as a physician, and I thought that maybe what God wants me to do is to utilize my skills as a physician to help people in pain and with addiction. So since 2018, that's what I've been doing.
Wow, that's an amazing story. So that you went to the River Jordan to get Christ. Amazing story behind. So it sounds very spiritual then, of course. Is there then spirituality now a big part in your life? So is it that you daily go into you and have that inner connection, and you were talking about God and spirit? So is it so that you go through life now after this with spirit always connected? Tell us more about that.
Yeah, I learned about the fruits of the spirit and am trying to live a life where someone may assign those fruits of the spirit of self-control, patience, things that I could do to help people. And, many times when I see a missionary go out to other parts of the world, they don't ask for anything, and I'm not asking for anything. What they do is they work and they do things, and people then ask them why they're doing it. And that's basically how I proceed in my life now. I just do the work, and if someone asks me, then I'll discuss the passion and the reason why I'm doing this to help people as much as I can. The opioid epidemic is in the United States, there's 100,000 people who are dying, and it crosses all walks of life, the rich, the poor, male, female, young, old. And I feel like, God gave me some skills and I'm supposed to use those skills to help these people.
That is very beautiful. It is really what I feel is really very connected to your soul and to your purpose, like you feel it for you or understand it for you. That right? So it's really some kind of purposeful living now.
Yeah, it's many people have a problem in terms of finding a passion in life or finding identity. And I think God has given me a way to figure out what my passion is. And it's been a part of my personality more and more since I've been baptized. And, it's really made my work much easier. When they say if you enjoy your work and you have fun at work, you don't work a day in your life. Well, this is a passion and it's a part of my personality. So it's just living.
That's the best way, I would say, to really implement it in completely in you and to feel whole, right? So to really have that clear understanding of why you are here and help with your individual soul gift. So did something help you to find that purpose and passion? Because I hear people saying very often, yeah, you're talking about authenticity and purpose and passion, but actually I don't know. I don't know what it is. So how can I find it? Do you have some kind of advice for these people?
Uh, I have a very good wife. That's really where it comes from. Lifelong Christian. And, I was not until recently. And so it's been very helpful. We discuss things. We try to talk about things. It is a way for me to understand life a bit better. As everyone may think about life, my wife has it all put together.
That's very beautiful. So you want to tell us that your relationship partner, your partner in life, is the big help also to find out who you are, right? So maybe also through mirroring or just from the life experience. Is that what you experienced then for yourself?
Yes. I tend to work hard, and as a physician, we we think about patients, but we don't think about patients in a way that's holistic. We don't treat the psychosocial needs of patients as well as we should. We treat the physical needs with medications and surgery and procedures, but when patients need empathy, I don't think physicians have that as their primary focus. And I think that's what I've learned from my wife. That's what I've learned in doing this iPill dispenser and Quivive Pharma. You know, treating patients holistically, I think, is one of the best ways we can help patients as a physician. Because if you're only treating the physical part, you're only treating patients 50% of the way that needs to happen. And if you're going to treat a patient holistically, you're treating 100% of the patient.
Mhm. And with holistically, you mean the spiritual side then? So the spiritual being, the soul.
Absolutely. I don't force religion on anyone, but when a patient asks me why I'm a doctor, why am I going through the hassle and the work and the um, problems that I have to deal with, I do mention the passion that I have and the reason for it, as I mentioned earlier. But I think that when you don't, when you treat patients as a person, not as a patient, I think it really is quite helpful, and it really makes my life a lot better because, naturally I tend to gravitate towards people, And when I gravitate towards people and I'm able to help them, we both win. I win because I'm helping someone and they win because they are helped.
That is so beautiful to hear. Yeah. So the patients might, yeah, recognize a difference, right? When you're talking to them and maybe they don't experience that so often, like you say, though very often it is not, yeah, not coming from that presence and consciousness that we are talking to that other soul. So we are looking in our patient record and we see the data and we see the case and we have already the diagnosis in mind and the treatment. But we are actually talking to that spiritual being, which is more than a physical body. So is it that what you mean?
Yeah. And when I used to put patients to sleep before I put them to sleep, I used to joke around with them. I used to talk to them on a more personal level. My nurses hated it because I spent more time with my patients, but at the end of the day, I have to give my patients less medication for pain, less medications for anxiety because they felt comfortable. They felt comfortable with what I was doing. They felt comfortable with what was happening. And when you smile and when you are able to talk to someone and joke around with them and introduce humor, they really let their guard down and they become more personable to me. They would tell me things that other doctors would not gather because, as an example, I would ask my patients, do you drink alcohol? And one patient would say, I don't drink anything. And the wife would nudge the patient and say, you drink 3 or 4 beers a day. And then I would joke around and then I would ask more information. How many drugs do you use? How much fun do you have in life? And then they open up and they tell me what helps me treat them as a patient.
Mhm. Yeah, that has a lot of impact, right? Of the blood chemicals when you're really bringing them. We're coming back to energy into a different yeah state of energy of being, right? So isn't there also studies around that, so that you in the terms you are yeah behaving as a professional, talking to patients and doing that, you can actually really, like you prescribe it, reduce the medication?
There's a study in um, the British Journal of Anesthesia where they talk about humor as a method to reduce preoperative anxiety. And I found it to be very true. In fact, because I use multimodal pain therapy, humor is medication. And it's good not only for the patient, but for me. If I'm
For the
happy,
whole environment, right?
if I'm happy and there's a positive flow, everyone works, things work out. In a very, very difficult situation, if you scream and yell, people make mistakes. If you say thank you and please during a situation where a patient's blood pressure is very low and people are very anxious, people stop and they feel like I'm in control, under control, and they do things without making mistakes as much. Everything happens in life that many people cannot control, but when you're able to treat even your coworkers with respect, I think that's really a positive move.
So isn't it that, yeah, you mentioned it already, every time something can happen, but hospitals and all institutions are doing a lot to reduce the risk of having adverse events, right? And failures. So isn't that a big impact also? You have really that culture impact, you have a different kind of atmosphere, you're having, yeah, people do not work with that kind of fear inside of them. So is there also any more studies around that?
Well, there's a lot of studies coming out now.
Mm-hmm.
Let me start off with a short story. I was late to clinic one day, and my patients were going from car to car, and I just simply asked one of my patients, "Hey, what's going on in the parking lot? Why are you going from car to car?" Well, we're picking up pills that we used that we don't have because we know that when you come and talk to us, you count our pills. And when we don't have the right pills, you sort of make fun of us and you get angry and you ask us all these questions about why we're taking so many pills, more than I had prescribed. And from that point on, I stopped using pill counts. And in that fashion, people are people. And that's why I really felt that, if I'm so focused on pills and not looking at the needs of the patient, I'm not doing what I should be doing as a doctor.
Yeah. So what is your idea? How could we advance pain treatment and all this around dealing differently with the patients? So what would be the approach you would prefer?
Oh, from top to bottom? For the government, I would hope that politicians who didn't go to medical school stop practicing medicine. In 2016 in the US, the CDC came out and said that no patient should be on greater than 90 milliequivalents of morphine. That means that patients who have a high dose morphine, they want it off of drugs. But you can't really just stop opioids, because if you do, you have patients going into withdrawal.
Mhm.
It's better if you slow down how they're tapered off medications so they don't go into withdrawal, so they don't go out and search for something like heroin or fentanyl or xylazine or perzolazine now that causes a lot of illicit drug use.
Mhm.
88% of the population in the United States of the overdose deaths comes from illicit fentanyl, not
Wow.
from prescribed fentanyl or prescribed opioids. 75% of patients do not take their medications as prescribed by their physician. You know, Pharmacies who dispense medications and physicians who prescribe medications have a myriad of rules and regulations they need to follow. But at the patient's home, there's zero. It's me asking politely for the patient to take their medications as I prescribe at the particular dose and time. And that really doesn't happen.
Mhm. Yeah, it's it's actually a disaster when we're thinking about that, right? That the patients have that medication here and maybe kids around playing and yeah, it's just not sure if they really can secure the medication then away from misuse, or just that there's happening accidents with it, right?
That's right. In fact, 125,000 people die a year from just taking their medications incorrectly. And that costs our country, the United States, $290 billion a year. When opioids are involved, you have opioid overdose deaths and opioid use disorder. And that costs the United States $1.5 trillion and about 100,000 deaths a year. So, when you think about it, there's a big push for artificial intelligence help in healthcare. And all that money, all that time and effort that we're spending in AI to help healthcare is thrown out the window if a patient takes 4 pills instead of two, 6 pills instead of two. We're really, as physicians and politicians and policymakers, really missing the boat because we're not really focused on the patient. And we all aspire to focus on the patient, but we're not. And that's what I learned. We need to focus on the patient more so now than ever.
Yeah, thank you so much that you're bringing that up, because I doubt that we really have the awareness of how huge this problem is. And when I hear you saying these numbers, it's shocking. Really, it's shocking. Death and misuse and costs and so on. It's incredible, right? And that's why we created this Healing Temple show to really bring that information out and make it more aware, to hopefully can change now step by step the things. We know we need time, but we need to start at some point, right?
I really feel passionate about doing this kind of work because, people are dying in pain and people are dying with cancer. In the last decade in the United States, there's been a 44% drop in opioid prescriptions for acute pain. and a 40% drop in opioid prescriptions for people with terminal cancer. And I'm talking terminal cancer. And I think it's really immoral for us to allow patients to die in pain and not in comfort. The whole industry of hospice is to allow patients to die with dignity and comfort. And we're not doing that.
Yeah, so true. Unfortunately, I had to experience that myself and my family when my father was in his last days at the hospital, and I could observe how the difference is between a ward, a regular ward he was before, and then we were actually able to bring him to the palliative care area, and it was a tremendous difference in his whole behavior. So he felt so much more relaxed, and he was in such better conditions. And of course, all the care around was different because, we know that this type of care, palliative care, has different kind of schemes and teams around. But it was so obvious for me, the change with different medication treatment and situation, what a relief that is for patients who are suffering. And also, I love very much that we have at the palliative care the awareness of spirit and the soul. So it's very implemented there. And I wonder why we are not able to bring that to all of the areas of the hospital. Like you say, that we see the patient and we're talking to the patient. And it's not only in palliative care when it's unfortunately very at the very end. So, but we really implement that processes, but mainly the awareness of the individual healthcare professional to have a different kind of culture and also training maybe. So I guess it's not so many courses about spirituality in the hospitals right now. So that we really change that and come back to, where you also started with our conversation, to say it's a purpose and passion for every individual. Why am I here and why am I doing that? And a different kind of treatment of each other and seeing each other as souls and not only as cases or numbers, right?
Part of the issue, I think, is money in terms of insurance companies. Insurance companies are a business. Understand it, completely understand it. They have to make healthcare profitable. Many times now, they're using ancillary care, nurse practitioners, PAs, instead of doctors because it is cheaper. And, one of the questions I used to ask medical students coming into medical school was, why do you want to become a doctor? And one of my questions was when they answered, I want to help people. And the question that you must ask is that, as a nurse, you help more people than doctors do. Nurses actually give really good care. Mm-hmm. And in that situation, many people begin to think about the difference between a doctor and a nurse. And doctors direct care, but nurses give care.
That is very nice how you're saying that. Yeah, and yet we have such big problem with lack of staff and nurses leaving the healthcare environment. And actually, I can say it was also a part of my passion to really help in the area. So that healthcare professionals, if nurses or physicians find back to their passion and purpose, that I help them to go out of the busy mind and to learn about the third eye and have the inner stability and navigation system and to reach their soul. Because I met so many very stressed healthcare professionals, and I was thinking about, well, what can I offer to support that they find their inner connection again and find their fire again, to ignite that passion again for healing, for giving care where they started, where all of you started actually, right? And it's so sad then if people need to leave their area, also they really love that job. They love to do what they do, but of course in different circumstances. And Yeah. So my belief is we can do something for it. And that's why we are talking here and why we are having the podcast show, to also encourage people to stay in the area, because we need all of you. So we will have a switch. I believe very strongly in that. We will go into a different kind of healthcare and healing environment, and it's absolutely needed, but we will need time also. We will not be able to do that from one day to the other, and for this we need all of you and all of the professionals to actually make this change, this big change happening, right? So talking about patients, how would you empower patients when you're talking to the patient itself to really make sure to stick on the prescription and the dosage you're prescribing, and to make safe use of the medication? So how would you see the best approach to empower patients to also be self-aware and responsible for what they're doing?
That's a fully loaded question. There's a lot of issues, a lot of problems. One of the ways we're doing that is with what I call is a bank mobile app that connects to a bank ATM for pills at home. It's basically where I use a mobile app to do a face print of the patient for biometric authentication, and I collect their vital signs using the phone itself. So we're using a lot of tech here. And then we connect that to a pill dispenser at home. The pill dispenser is important because we can securely deliver it to patients' homes, reducing barriers to care, such as transportation, cost of care. And then we are able to detect if a patient takes their medication or not. And then we can notify family, friends, and the caregiver to help remediate that missed dose. If the patient tries to break into the device, we actually destroy the tablets immediately in the device itself upon tampering, and at the end of 30 days, so that there's no unused pills hanging around in the medicine cabinet to be abused, diverted, or used in an accidental overdose. Then we add in psychosocial support with telehealth, and we actually are monitoring the patient, because we can get vital signs from the phone camera, and we can add in a small NFC chip onto each pill that allows me to determine who's taking the pill and when they take it, because that NFC chip is about the size of a human hair, already FDA approved, and it sends a signal to the app that then collects the time and date that the person who I prescribe the medication to is getting the medication.
So I'm surprised. So I would put in the pill with the chip, actually.
Yeah, you would ingest the pill with the chip. The chip is very small. It looks the same swallowed as it comes out of you later on.
Okay.
Very, very small.
So it's not toxic, of course.
No.
So it sounds really like a magic box, right? When you're telling us what this device is doing, even destroying the pill. So how does that happen? How does it mechanically happen?
Well, it's a small little dried up battery that connects to a like the example is a car fob. If you think of a car fob, when you use keyless entry to enter your car, it's the same. It's not really Bluetooth, but it's NFC, near field communication, using a small signal that sends it to the app that I can collect.
Yeah. And how is the current process then that the patient gets this device? So how is it organized? Is there a hospital then? So does the patient leave the hospital and get some recommendation or some prescription also of the device? So how is it handled?
Well, we need to we need to help the patient from a health economic portion and a patient outcome portion. So we're avoiding insurance. One of our biggest customers is going to be the jails. 65% of jail detainees have an opioid use disorder. And when they leave, there's no way to make sure that those patients are taking their opioid use disorder drugs. So
Yeah.
we give two dispensers to the detainee after they leave the jail so that we can determine whether they're taking their drug and when they're taking it. And if they don't take it, we can help their family, friends, and their caregiver remind them to take it. The importance of a detainee taking their drug is the fact that when they leave, there's a 129 times higher chance of overdose death in the first 2 weeks. And that's because patients in jail, detainees in jail, are not treated for opioid use disorder in jail, and 40% of them go through withdrawal. When they're not treated in jail, they have lowered tolerance to opioid. And the first thing they want to do when they get out of jail
Yeah.
is die. And that's why they die. And we're trying to prevent that.
Okay, very interesting. Yeah, of course, I did not think about it in the first way as we were speaking about the healthcare market, but it's actually the jails, yeah, to see where the drugs are used. Yeah, and what partnerships or collaborations would help you then to bring that journey further? So, is there any specific partnerships you're looking for your business for going further?
There is. There's one I want to avoid, and that's commercial insurance to start, because they pay for a device, and then for opioid use disorder, they really don't pay for opioid use disorder treatment either. But for a new device, they want a lot of data, and then they want health outcome, patient outcome evidence. So that takes years. My company wouldn't exist if we went to commercial insurance and relied on commercial insurance. So we're going to jails, opioid use disorder clinics. I mentioned the jails already, the opioid use disorder clinics. We're revenue sharing with them, which means that we follow remote therapeutic monitoring codes, and then we give these devices to patients with reduced patient costs. The third customer that we're really focused on is the VA system, veterans who fought in wars, because often they come home from war injured or in pain, and they take opioids. You know, in the United States, there's 208 clinics that are treating 6,500 veterans, but 400,000 veterans need care, and they can't get it because there's just not enough clinics, not enough doctors. So we actually package the medication in the iPill dispenser and mail it to the veteran, and they sign for it and they get it at home. If it's easy, they're going to do it. And if we make sure they take the medication for as long as they need to for opioid use disorder, we can re-enter them into society without the diagnosis of opioid use disorder.
Okay. Yeah. So, and when we're thinking about what we are unfortunately creating right now on the earth with all that wars and conflicts, we can imagine how big that is, the number of people who actually need pain treatment and also help with disorder, right? So it must be huge, actually. So the demand, unfortunately, of course, we would love to see all people healthy and not need to go that path, but reality is reality, and we want to help and support to bring people back to health and a healthy and fulfilled living, right?
Yeah, and you asked me about what I could do to help. Is that one of the things is that, you know, only 5 to 11% of the people who have opioid use disorder are able to get treatment because, you know, commercial insurance doesn't pay. There's a stigma around getting treatment. There's a stigma around treatment. Many patients don't understand that there is treatment. And then there's the medical field. We have medications that can reduce the opioid overdose death rate by greater than 50%, but many doctors don't want to prescribe these medications because it's an opioid too. And doctors fear prescribing opioids at this point. They fear the DEA coming in and auditing their practice and taking away their license or putting them in jail. There's a mess in healthcare regarding opioid use disorder.
So what is your call to action?
I think the call to action is to treat patients for pain. That's the first episode, because as I said, the reduction in opioid prescriptions has caused patients to not get treated for pain. And, if you're in pain, you're going to want to get out of pain. And it's natural for patients to go to heroin and fentanyl and illicit drugs. So I think the first step would be to treat patients with dignity and treat patients for pain. And I think we need to do what's called multimodal pain therapy, where we actually use many medications to treat every different aspect of pain, because pain has many different forms. If your dog bites your leg, that's physical. If you have an injury where your brain remembers the injury, that's neuropathic pain. Then there's pain from psychosocial issues. Somebody verbally abused you or verbally attacked you, that's psychosocial pain. Pain in the pain that you can treat with psychosocial care. And then there's pain that you have from or use of opioids from other reasons. Like people just want to, if they're depressed or have a bad day at work or have an argument with their wife or husband, they want an opioid to help them get through the day.
Yeah.
So
what I hear you saying, it's a more holistic view also on what is pain, where does the pain come from, and how do we deal with it, where we can all work together, right, to help people. Because there's different ways to do so. So of course I would have my shamanic way, my energy medicine, and you would have the opioid side, whatever is needed. But I think we have the common theme that we want to help the people to really get to the root cause and to really avoid that the pain and the problem gets bigger, right?
I think that's an excellent point, because many patients do not get enough sleep. They feel anxious, and that's one of the biggest focuses of my treating pain, is to make sure patients are able to sleep at night and then to have a more positive attitude.
Yeah. Okay. So thank you very much, John, for all the information about the safer opioid handling and pain treatment and all the insights you have given us for this topic. So let's close the cosmic powerhouse again. So take that field again. And thank you so much. And let's create a healing temple together in all our experts areas. Thank you so much, John. It was a pleasure to having you here, speaking to you. And thank you to our audience listening to us. And please follow up. Let's create a healing temple podcast show with further episodes. Thank you
very much for having me.